Nigeria today confirmed its first case of the coronavirus. The government says that it has also received a protocol from the Chinese government to treat persons infected with the coronavirus Covid-19. The Minister of Health, Dr. Osagie Ohanire, disclosed this at a news conference on Friday in Abuja following the confirmed case of the virus in Lagos. He has explained that the government of China, where the first case of coronavirus was reported, has succeeded in treating thousands of people infected with the virus and will not be a problem containing it. 2 visits already from the ambassador of China to Nigeria is reassuring that China is committed to supporting Nigeria in any way it can. What does this mean to you as a citizen? Are the structures to contain the entry of any other case of coronavirus in Nigeria, one having been recorded already? Are they being activated at the moment? We'll focus on this in just a moment. Data feeds are coming through though in one place simultaneously on all our social media platforms, on channelstv.com and on youtube.com/channelsweb. You can follow us live on m.channelstv.com and on Facebook as well. We've got all our platforms on social media covered. Tweet at Gimba Umar CTV and use the hashtag State of the Nation. Let's get your thoughts in. It's prime time here in Lagos, and this is State of the Nation. Welcome everyone. We're following up on the biggest story yet, COVID-19. Nigerians today woke up to the news of the confirmation of one case of the coronavirus disease by the Minister of Health, Dr. Osagie Ohanire, in a statement issued in the early hours of Friday, February the 28th, 2020. That's an important date. According to the statement, the case involves an Italian citizen who works in Nigeria and just returned from Milan, Italy, on the 25th of February 2020. He was confirmed to be positive by the virology laboratory of the Lagos University Teaching Hospital, part of the laboratory network of the Nigerian Center for Disease Control, the NCDC. The patient is clinically stable, we have been told, with no serious symptoms, and is being managed at the Infectious Disease Hospital in Yaba, here in Lagos. Before now, though, the Minister of Health, Dr. Osagie Ohanire, and his team assured the nation that all measures have been activated to ensure that the virus doesn't get in whatsoever. Take a listen.
The preparedness, mostly at the airports, the international airports, which are the main points of entry into the country, Lagos, Abuja, Port Harcourt, and Kano. And also the fact that all patients arriving in Nigeria are screened and the temperature taken.
No patients.
Sorry, all passengers. When doctors speak, you still notice. That all passengers arriving are screened by a passive camera that takes your temperature and also looks at your travel history to be able to find out where you're coming from and what risk you may be carrying.
That's on the one hand. A professor and lawmaker, Robert Ajayi Boniface, earlier warned that but for a form given to entry passengers at the airports, there was nothing to suggest a state of preparedness in an event of a case recorded in Nigeria. Take a listen.
Is that prevention is better than cure. When we landed in South Africa, we were not allowed to leave 30 minutes. Officers of the medical corps of the South African Army came into the aircraft and screened everybody before we were allowed out of this aircraft. When I arrived yesterday at the Nnamdi Azikiwe airport, there was no screening. All we were given is a sheet of paper to indicate that whether we were sick, whether we had been to one country or the other, and how we'll be contacted in emergency. What are you contacted in emergency? How do you train me? How do you know whether I fall sick after I left the airport? So this is very frightening, Mr. President and distinguished senators. Very frightening. And I think something has to be done to ensure that we do not give way to a situation which we will not be able to control. So, Mr. President, I hope that I'm making this observation for Nigerians to note and for the Ministry of Health to take adequate action. We should be screened before we get into the airport.
Well, those two divergent views sets the path for our analysis today on State of the Nation. Dr. Emina Valley is a public health consultant. She's here with me in our Lagos studios. I want to thank you so much indeed for joining us on State of the Nation. Also joining us from our Abuja studios is Dr. Funke Adesina, an epidemiologist. Many thanks indeed to you as well for coming on the show. At some point, we'll also have another doctor joining us on the show as well. But let's continue with you in Abuja. Doctor, analyze this statement of the Minister Ohanire and the fears of lawmaker Boniface and how one case confirmed just after those two submissions. How concerned are you?
Well, thank you so much to have come to this section to talk to us about the coronavirus. Just like what Commissioner, one of the ministers said, we should get an adequate preparation, especially at the point of entry into our country, of which I know that most of the health people, the leaders, the ministers, the commissioners of the states, they're also preparing for it now. And they've already prepared in terms of our health facilities to lodge all these cases in case if there is anything of such, if there's a case.
Now, the lawmaker, Professor Robert Ajayi Boniface, earlier gave that warning and said that but for a form to be filled given at entry points to passengers at the airports, there was nothing to suggest a state of preparedness in its entirety in an event of a coronavirus outbreak. One case has now slipped through. What might have happened in your estimation?
Well, what our minister said, it's something that you have to look into. Because filling a form does not necessarily mean that you get the whole information about that patient, especially what we're really looking for. Fine, you may get the biodata of the patient, but for actually to test the patient at the point of entry, I think is key and is essential too as well.
We can get to that point whereby the reports that he's relying on his own reports, those thermometers are not at the entry points.
Well, I think it should be there. I don't know why. I think I expected that all those things should be there.
Okay, let's also bring in Dr. Ifeanyi Nsofo. He is a 2019 Atlantic Fellow for Health Equity at the George Washington University in the US. He joins us via Skype. Many thanks indeed, Doctor. Share your views with us on this minister's assurance that he gave Nigerians all in a place. At the screening of passengers, we ought to have a situation whereby we prevent any virus from getting into the country, but that has failed. Share your thoughts with us on that.
Okay, thank you so much, Gimba, for having me. I think, first of all, is to say that it's very important for people not to panic, and express fear at this point in time, but also to review what the Nigeria Center for Disease Control, working closely with the Federal Ministry of Health, what they've done over the past few weeks to educate Nigerians about the coronavirus and the risks that exist and what Nigerians ought to do. And I listened to the interview of Senator Boniface, how they got to South Africa and the Army Medical Corps came on board to screen them. The question is, what screening did they do? They probably used thermal thermometers, thermal guns to check their temperatures. And if you land at the Abuja International Airport, there's a computerized thermometer that people walk across, and it picks up their temperatures. If your temperature is very high, higher than normal, and combined with your travel history, of course, they will call you aside and ask more questions and find out details. So in terms of preparedness, I know that the Nigeria Center for Disease Control has sent out their staff around the country, even before this case was picked up in Lagos yesterday, sent our staff across the states in Nigeria to train state ministries of health on how to do risk communication with different communities. And risk communication here is simply, knowing what to do in order to prevent yourself from being infected. And also, the Nigeria Center for Disease Control has, developed a manual for health workers on how to manage, the coronavirus if it happens. And the fact that we picked up a case on its own is not a bad thing, because it shows that the surveillance system works. And the fact that we have 4 reference laboratories being managed by the Nigeria Center for Disease Control that can screen for the virus in the country. So I think in terms of preparedness, informing Nigerians of what to do.
You say that
being
system and the equipment there, you say that they work. How comes one case slips through? A lot of people are so concerned that how comes one case slips through and then you say that the system works? Where has the system failed such that one person gets in?
Okay, so let's also look at it. The person, this particular case, is an Italian citizen who visited Milan and came back to the country. By the time the person probably got to the airport, the person was not symptomatic, did not have any fever. So how else? There's nothing else for you to do at the airport to know that this person, could test positive in 2 days. Absolutely nothing, apart from the temperature that you would take at the airport. So if the person was
let me start this conversation and bring it back to Lagos here in the studio with me, Dr. Valley. You are the public health expert and consultant at that matter. We have been told that he flew into Nigeria from Milan, and then we've seen some of such cases. And the kind of response other governments have taken. The US has done that, has brought out its citizens from Wuhan, especially in China. We've seen Saudi Arabia also do that, but they have them quarantined and been kept for about 14 days before they're allowed into the country. Is it the case of Milan not being one of the countries where the outbreak has been recorded? So much so that the level of concentration on that flight and the people who came in that flight was somewhat reduced.
Okay, I would like to say that at the airports, they do both primary and secondary screening. Primary screening, you're just coming in, they give you a form to fill. They check your temperature with the computerized thermometer that it mentioned. And if you fill the form and you have something on the form that suggests that you may be a suspected case, or maybe your temperature was high and there were symptoms, they take you from that primary screening to the secondary screening. Okay, so at the secondary screening, there are doctors there that look at you critically, take more history, examine you, and isolate you if they feel the case of a suspected case. Okay, so for this Italian guy that came in, there were no symptoms at the time he came in. So it's likely he will have gone through the primary screening and he was not picked because there was nothing to be picked.
So is it very possible now that because he was not picked, and then the contacts in that plane that he has made, or should I say, of course, they are all in the same plane. What risks are there concerning the spread, looking at the people who were in that plane with him?
Yes, I said it before.
Is it a big risk?
Not that a big risk, but it's only a risk. Let's say 50-50, in the sense that we don't know what kind of contact they've had with the index case. So it depends on the degree of contact they've had with the index case. And like we said, we didn't know if he was coughing. At the time he came in, there was no symptom that was picked. So it's likely they might not have like serious contact with him. Maybe he didn't cough into the air, maybe people didn't like embrace or shake it. So it depends on the degree of contact. And so at this time,
so just being in the plane is not a risk?
It's a risk, but it might not be so large if he didn't come in contact with them. But of course, like I said, there will be a line listing, and each one of them will be followed up and will be traced.
Okay. Dr. Adeshina, I'm going to be asking you if our strategy is right when we return after this break. Join us again. Welcome back to State of the Nation. Dr. Adeshina, I'm just wondering if our strategy in combating coronavirus is right, because it would seem to suggest some people believing that the government ought to have done even more at this point to ensure that we don't even have that case. Do remember that over 600 million naira has been thrown to try to contain an eventuality whatsoever of coronavirus getting into the country.
Thank you so much. The strategy is really right. Just like the earlier speaker have said, you know, if the person is coming as an asymptomatic, there's no really what you can pick from that person. And for the person to go through the primary screening and didn't really show there's no symptoms, there's nothing to pick from him that is really having the case. The strategy is right, quite all right, because the government are really prepared. I know the top people, especially the minister, the commissioners, in fact, the leaders of NCDC, they are really prepared. They've deployed a lot of people. They have a lot of things in place to check this. If I don't know anything, I know in Lagos, there are a lot of strategies to this. There are community-based facilities in which to take people to. There are equipment on ground. And to take, for instance, why you will believe me that the strategy is right is that despite the fact that the person is asymptomatic, they could not pick anything at the airport, but immediately it landed here, they were able to do the screening, they were able to, because of the high index of suspicion, they were able to pick the patient with the clinical examination and the clinical symptoms and high index of suspicion, and they were able to take the sample. And for the fact that we have a steady, workable, functional laboratory on ground, of which it gets across all over the countries, they were able to pick the sample and run the sample here, and they were able to pick it and to be positive. If the strategy is not being right, you know, it won't be like that. It will be maybe something we have to take dates, times, minutes, you know, hours before we're able to do this. Unlike in the case of Ebola, you know, those days, they have to take the sample, traveled out, and they took it abroad. But look at this one. It wasn't like that. It's, you know, it's within those preparation, those things that they prepared on ground, we're able to use and to get the patient diagnosed.
Because Dr. Nsofo is very eager to make more contributions to this. Doctor, this is a virus that is spreading so fast. We saw that happening in China and spreading to other Asian countries, even in Tokyo, Japan. It's also there. They have the facilities, no doubt. Some believe that it's not necessarily about the facility per se, but the human resource deployed to contain it. Is that the case for Nigeria? I mean, we defeated Ebola in 2014.
Okay, so, yeah, and I'm happy you landed on we defeated Ebola in 2014, and also we'll soon defeat polio. So there's already a structure in place to deal with some of these things. I mean, are there gaps? Are there gaps that need to be filled? You know, absolutely. But I think that if we look at the level of preparedness by the Nigeria Center for Disease Control, we know at least that we can test, you know, locally here in 4 laboratories across the country. And we know that we have facilities to manage the cases when they happen. This particular case, at least based on the briefing from the Honorable Minister of Health, the person, you know, is not very sick. You know, the infection is mild, and the person is being managed at the infectious disease hospital in Yaba. Because ultimately, the symptoms are just like the symptoms of common cold or symptoms of, you know, some symptoms of malaria or some other, you know, basic illnesses that we have. So as long as, at least if we look at what is happening in other countries, you know, with a lot more cases, we see that fatality is higher in, you know, in the elderly or people that have pre-existing illnesses. So if we look at it from that angle, we can say that at least we have one. And, you know, the Nigeria Center for Disease Control, working closely with Lagos State Ministry of Health, they are trying to trace the contact of this particular case and ensure that, you know, they trace everybody concerned, but also to tutor them on what to do just in case if they start having symptoms of their own. But I think for us as Nigerians, what we really need to ask ourselves is, we cannot as a people be very reactive once we have infectious disease outbreaks. We must be interested in the preparedness that happens before the outbreaks occur on their own. So the question now is, yeah.
Okay, let me flip it here, just so that I get your own views too. We're trying to wrap up as quickly as we can, but this is what the Chinese government has said that it is doing to help Nigeria. It says that it is providing Nigeria with the treatment protocol. What does that mean?
The guidelines to follow when somebody has coronavirus.
So now, with that protocol, it has succeeded in treating about 5,000 people in that country, in China. But does that give us a degree of comfort?
Yes, I think it does, because what we or the other must learn from people's experiences or past experiences. So if it has worked there in China, yes, it can work here in Nigeria. And like I said, in Ebola, I worked during Ebola. And we had a lot of people that worked. We did contact tracing, we did jingles on the radio, we did a road show to get people aware of the situation. And those experiences we've learned during Ebola, during Lassa fever, other outbreaks can also be employed during this coronavirus. So I think everybody is just trying to calm down and just support. If you have any information whatsoever, be ready to come out to say, okay, like I came in contact with this person, I traveled to this place, what should I do, how should I go, who should I meet? So once we are ready to be responsible individuals, to come out and take ownership of our own actions, I think it's a small case. We can easily handle it.
Indeed, the NCDC, they have their numbers out there. You could just check it out on their website as well. But let's get back to you, Dr. Adeshina, in our Abuja studios now, because a lot of people are wondering what state governments, the Ogun state government, for instance, where they said carrier of that disease visited the Ogun state government. What do you expect they be doing by now?
Right now, I'm very sure they too, they must have, tried to get people on ground and people to really actually do the contact tracing. I'm very sure the epidemiology and the other health workers of that state, they must be on ground now and start doing the contact. They must have started the contact tracing. And I want to assure you as well that NCDC, as one of the speakers have mentioned, they deploy a lot of people. In fact, by way of it, I'm one of the MFLT presidents, of which the NCDC have trained a lot of people that are supposed to be the frontliner in case of this. And this is actually one of the preparation at which the government is also trying to make in case event of such happen. In Ogun State, a lot of people are there that have been trained as epidemiologists, and they have the technical know-how, they have the skills to do the contact tracing. I think they have even started, I can assure you.
Dr. Nsofor, let's get your closing thoughts on this as well. Going forward, looking at solutions, what should you and I be doing?
Well, I mean, the NCDC has put out, information on that. So first of all, hand washing, basic hand washing. People must inculcate that as a habit and make sure that they wash their hands with soap and water, as frequently as possible. The way we sneeze, don't sneeze into your open palm, sneeze into the cover of your elbow, sneeze into tissue and properly dispose it. If somebody is sneezing and has fever, make sure you're like 5 to 6 feet away from the person. Disease from, using your, fingers and hands on your face as frequently as possible. But I think as a people generally, we must really begin to support what the Nigeria Center for Disease Control is doing, because preparing for epidemics is not cheap, but it's cost effective. So, the federal government must budget appropriately for the NCDC, but also states. How many states in Nigeria have a budget line for epidemic preparedness? As NCDC is battling with coronavirus, it's also battling with Lassa fever, the largest outbreak in the country right now.
I can imagine that they have to contend with all of that, but I must sincerely thank you for talking to us on State of the Nation. Dr. Ifeanyi Nsofor, a 2019 Atlantic Fellow for Health Equity at the George Washington University in the United States of America. He joined us via Skype. Many thanks indeed for talking to us, as well as Dr. Emina Valley, a public health consultant. Many thanks for talking to us, as well as Dr. Adeshina in our Abuja studios. Many thanks indeed for talking to us, and to everyone who's been part of this show. Stay safe, It's coronavirus that has entered into Nigeria. We must all work together, keep those hygienes up, and ensure that we defeat it as we did Ebola. I am Gimba Umar. Bye for now.